Hey everybody, it is Thursday night on Breaking the News Plus. I'm Janice Shortle. We're going to have a candid conversation tonight about Medicare and Medicaid. It's open enrollment season, and there's lots of changes that you need to know about before you take a look at those plans. To join me tonight, Kelly Jo Greiner, the Medicare Program Director at the Minnesota Board on Aging, joins us. Hi, Kelly Jo, how are you?
Hi, great to be here.
Thank you for being here. So we are in open enrollment right now, and I know that some seniors are going to face some documents that they may have some questions about. What should they be looking out for in this open enrollment period?
It's a great question. Every Medicare beneficiary gets what's called an annual notice of change from their current plan, and they should make sure that they keep that document. Don't throw it away because it's going to have all the changes outlined in there that they will have for 2026. Our concern every year is that people get so much mail before and during OEP, and much of it ends up in the recycling because it's just overwhelming. And that is one document we don't want people to just get rid of because of the amount of information it gives. So that's the number one thing that they should be looking for.
Is it something that they need to look for because they need to be aware of changes coming? I mean, top of mind is cost, and there have been some warnings that premiums could raise by as much as 18% next year, maybe even higher.
Yes, that's right. The annual notice of change will tell the Medicare beneficiary what changes are happening, including the premium increases. We are seeing in Minnesota premium increases of about 80%, which is actually higher than the national average. And we are seeing a number of Medicare Advantage plans no longer participate in Minnesota starting January 1st. One of the biggest ones is UCare. UCare is closing their Medicare Advantage plans, and it will affect 158,000 Medicare beneficiaries in Minnesota. So as you can imagine, we are extremely busy at Minnesota Aging Pathways, which used to be the Senior Linkage Line, which is a service of the Board on Aging and the area agencies on aging that helps people with Medicare, helps them understand their options and make enrollment decisions and actually do the enrollments and assist them with that. And we are seeing about 2,000 calls a day since
Whoa.
OEP began. And usually we get 200 to 300 calls a day. So as you can see, that's a huge increase. There are a lot of very unhappy Medicare beneficiaries right now in Minnesota. They're very unhappy because the premiums are increasing, the networks are changing in terms of providers, the deductibles are going up, the supplemental benefits are decreasing, and the supplemental benefits are something that are they appeal to Medicare beneficiaries because it helps them get eye care covered, hearing aids covered, dental care covered, and also gym memberships. And a number of the Medicare Advantage plans are doing away with those or cutting them significantly, which we have not seen in previous years.
That's a lot to take in, but Kelly, I want to back up a moment. Did you say an 80% increase?
No, I'm sorry, 18%.
18%.
18%,
Whew,
yes.
I mean, it's still a
Yes.
big one, but
Oh my
thank you.
gosh, not 80. No, 18.
Okay. And so with an increase that big, and we're talking about Medicare and Medicare Advantage, these are folks that are typically on a fixed income. That's a big increase.
Yes, it is. Especially when we don't know what the Social Security cost of living adjustment is going to be. And that will be announced next week. Because is that going to be a sufficient amount to make up the difference in the increased premiums they're going to have to pay for their Medicare plans? We don't know. We just don't know at this point in time.
And so you pointed out you typically get a couple of hundred calls a day, but now you're facing thousands of calls per day. I assume those are difficult calls from people saying, what can I do? I can't afford this.
And what we're doing is the first thing, because of our high call volume, we are encouraging people to call 1-800-Medicare, which is the national Medicare line that can help people look at their options and enroll in a plan, or if they have computer access, to go to www.medicare.gov and go into the plan finder. And through the plan finder, they enter in information about their unique situation, and it will produce options for them to enroll in for 2026. And it gives everything from the premiums, the drugs that are covered, the providers that are participating. It's really a great tool for people to try and use. And if they use it and have questions or aren't sure about it, they can certainly call us at Minnesota Aging Pathways, 1-800-333-2433. And one thing I do want to mention is we just posted on our website yesterday a video that we produced that helps walk people through how to use the Medicare Plan Finder. And so we hope people will visit our website at Min Aging Pathways and take a look at that video, because I think you'll find that really helpful.
Yeah, because so much of this can feel overwhelming. It feels overwhelming to me, and I'm not in these programs. I could, on a personal note, my mom called me today. She's in her late 70s, having a real tough time navigating what her options are. The health coverage she has this year, she's not going to be able to afford to keep it next year. So does a person like that have options?
Yes, definitely. For people that are on low to modest incomes, there are programs available that can help pay the Medicare costs, the premiums, the deductibles, the coinsurance, and can have greatly reduced prescription drug costs as well. And we encourage people, when they call, to check in to see if they're eligible for those programs. We screen those people for those programs at Minnesota Aging Pathways, and it can greatly reduce the out-of-pocket costs. The other options is when you're looking at the plans in Medicare.gov, it will show the plan premiums, and you can produce the plan list according to premium. So you can see which one is going to be the least expensive versus the most. And I will tell you, we will have some plans in Minnesota that are zero premium. What we want people to understand is, even though there isn't a monthly premium for the plan, there still are going to be other costs. There may be co-pays, deductibles, coinsurance, costs that the person has to pay as a result of being in a plan with that $0 premium. And so that is something really important, that to understand there are plans out there that are lower cost, that will cover what people need to cover. It may not be the perfect plan this year. It may not be, but we will help them sort through their options and make hopefully the best decision for them.
I'm just curious how y'all manage 2,000 calls a day. I mean, that certainly is showing me, probably showing you, that there is a need that's got to be met for folks to get this done in the enrollment period.
This is huge. I mean, the funding, of course, is never sufficient, but we have an amazing staff. Our staff are primarily social workers. We also have some nurses, and we have some highly trained volunteers that are helping as well. And they go through a very rigorous training, because Medicare is not an easy program to understand. And then they are the ones providing that individual assistance to callers. And I have to tell you, the feedback that we get from the service people receive is very, very positive. Now, right now, with the call waits, it may not be as positive as normal, but we are doing our best to help as many people as we can each and every day.
Does it surprise you the call volume is so high?
Yes. We did not anticipate it was going to be this high. We knew there would be a lot of UCare enrollees calling us, because one of the things about UCare is it's been a plan that's been around for a long time. A lot of people that were enrolled in that plan really liked it and didn't make a change for many years. And now all of a sudden they don't have a choice. They have to make a plan change for 2026. And so that is a large part of what our call volume is right now, is we're helping those UCare enrollees figure out what to do for 2026, as well as still getting general Medicare beneficiaries that are experiencing change in plans, change in premiums. They may be losing their plan because not all plans are going to be in all 87 counties this year. There are changes that are happening.
Yeah, we're losing plans in Minnesota, right? They have fewer
Yes,
options.
we are. Yes, we are.
And so it's just kind of like coming at you from all fronts. Kelly Jo, what would you say to folks that watch this tonight? They're just feeling kind of hopeless. Like this just seems too big to figure out. I mean, we certainly want everybody to have health care and not to just let this slide.
I would say, number one, realize that you have time. You don't have to make the decision right now. You have till December 7th. So everybody right now, I think, is rushing to call us because they think they need to enroll in a plan right now for January 1st, and they don't. They have till December 7th. The other thing to keep in mind is there are good options out there available in Minnesota, and our goal is to help people have coverage January 1st. The worst thing that a person can do this year is to do nothing. If you do nothing, you are going to be hit with many surprises on January 1st that you do not want to encounter. Just take my word for it. You don't want to not do anything because it is going to come back and affect you in a very negative way. People need to look at their options. They need to figure out what they want in terms of cost and coverage, enroll in a plan by December 7th. And then also, if they are a UCare recipient, make sure that they enroll in a plan that is hopefully comparable to the coverage they had with UCare, but not only that, so they have coverage starting January 1st that is not reliant on only having what is called original Medicare. If the UCare enrollees don't do anything, they will just have original Medicare on January 1st, which is Medicare Part A and B. They won't have any drug plan coverage for prescription drugs, and they will have to pay all the Medicare Part A and B deductibles, coinsurance, and copays, which can be very large out-of-pocket costs. So I don't mean to scare people, but I'm really trying to motivate people to understand this is not the time to just sit idly by and let things happen like you may have done in previous years, because things are happening to you in terms of your plans. And so you need to see what you can make happen for yourself to be good in January of 2026.
Well, the best thing you can do is maybe a first step for folks that watch this tonight is to make that call to you all. So would you mind giving out the phone number?
It's 1-800-333-2433. And we used to be known as the Senior Linkage Line. And then we're also encouraging people to call 1-800-MEDICARE. They are open 7 days a week, 24 hours a day. And then also, if you have computer access, go to www.medicare.gov and give the Plan Finder a try. And then check out our website for the video as well.
Right. Lots of options just to get started and key
Yes.
to get started. You do have time. Want to make that clear, but want to get the word out to folks that need help, and they can watch this video as many times as they want. Bookmark it, so you have the number, you have the websites. It's just important to get you covered. Kelly Jo, we appreciate you being on Breaking the News Plus tonight.
Thank you so much for the invitation. I think this has been helpful to our viewers, and just want to let you know we really are here to help with this critical time that is happening right now in the world of Medicare.
We appreciate you. That's all for us on Breaking the News Plus on this Thursday night. Thanks for joining us. We'll see you next time.